Did you know that after the age of 40, your hormones begin to shift silently, sometimes dramatically, affecting everything from your energy to your mood to your long-term health? Most people think of menopause as a women's issue. Fewer have even heard of andropause. But the truth is, both men and women go through hormonal transitions that can impact weight, mental health, sex drive, sleep, and even increase the risk of chronic disease. Today, we'll talk about the real science behind menopause and andropause, what the symptoms look like, and how to manage hormonal imbalance naturally and medically. No fluff, just facts. Section 1. What is menopause and andropause? Menopause is a natural biological process marking the end of a woman's menstrual cycles. It usually occurs between ages 45 and 55. Clinically, a woman is in menopause after going 12 months without a menstrual period. But it's not just about periods stopping. What actually happens is a significant drop in estrogen and progesterone, the primary female hormones. This hormonal crash doesn't happen overnight. It starts during a stage called perimenopause, which can last 5 to 10 years. In men, the equivalent process is called andropause, sometimes referred to as male menopause. While it's more gradual, it involves a steady decline in testosterone levels, usually starting around age 35 and accelerating after 45. Testosterone drops by about 1% per year after 30, and by age 70, most men have lost over 30% of their peak testosterone levels. These hormonal shifts are not just about aging. They influence mental sharpness, physical performance, bone density, and even your risk of early death. Section 2. Common symptoms of hormonal imbalance. Let's break down what this feels like, symptom by symptom. For women, menopause and perimenopause, hot flashes, sudden waves of heat and sweating, often at night, mood swings and anxiety. Rapid hormonal drops affect serotonin regulation. Sleep disturbances, difficulty falling or staying asleep, weight gain, especially in the belly and hips, low libido, reduced desire and vaginal dryness, brain fog, poor concentration and memory lapses, joint pain and fatigue, often mistaken for arthritis or aging, irregular periods, unpredictable bleeding patterns. These symptoms can start 5 to 10 years before menopause even begins. That's why many women in their late 30s or early 40s feel off without knowing why. For andropause, fatigue and low energy, even after full sleep, reduced sex drive, lower libido and erectile dysfunction, depression or irritability, often misdiagnosed as midlife crisis, muscle loss and increased fat, especially around the abdomen, decreased bone density, silent risk of fractures later, sleep problems linked to lower testosterone, cognitive decline, slower thinking, poor memory, gynecomastia, enlargement of male breast tissue. The biggest mistake men make is thinking they're just getting old, when in fact, it's hormonal and often treatable. Section 3. The risks of ignoring hormonal imbalance, 5 to 630. Ignoring menopause and andropause doesn't just affect comfort, it increases long-term health risks. In women, falling estrogen increases the risk of heart disease, osteoporosis, insulin resistance, Alzheimer's disease. In men, low testosterone has been linked with metabolic syndrome, type 2 diabetes, cardiovascular disease, early mortality. Low hormone levels don't just make you tired, they quietly change your metabolism, your brain chemistry, and your ability to recover from stress. Section 4. Medical testing and diagnosis. If you're experiencing any of these symptoms, get tested. For women, FSH and LH measures pituitary signals, estradiol, main estrogen level, progesterone and testosterone, supporting hormones, thyroid panel to rule out thyroid dysfunction. For men, total testosterone should be 300 to 1,000 nanogram per deciliter. Free testosterone, the active hormone, DHEA and estradiol to evaluate hormone conversion. SHBG, sex hormone binding globulin that affects availability. Don't self-diagnose. Work with a hormone specialist or endocrinologist. Section 5. Natural ways to support hormonal balance. Before jumping to medication, there are science-backed ways to naturally improve hormonal health. 1. Strength training. increases testosterone and human growth hormone in both sexes. 2. Healthy fats, omega-3s from fish, flaxseed, walnuts support hormone production. 3. Quality sleep. 7 to 9 hours of deep sleep regulates cortisol and testosterone. 4. Stress reduction. Chronic stress increases cortisol, which suppresses reproductive hormones. 5. Avoid endocrine disruptors. Limit plastic use, artificial fragrances, and processed food chemicals. 6. Vitamin D, magnesium, and zinc, essential for hormone synthesis and receptor sensitivity. These methods won't fully reverse hormone decline, but they help optimize what your body can still produce. Section 6. Medical options and when to consider them. When natural methods aren't enough, modern medicine offers help. For women, HRT, hormone replacement therapy, replaces estrogen and progesterone to relieve severe symptoms and protect bones and heart. Bioidentical hormones, molecularly identical to natural hormones, gaining popularity. Low-dose antidepressants, used for hot flashes and mood swings when HRT isn't suitable. For men, testosterone replacement therapy, TRT, can dramatically improve energy, mood, libido, and strength. Clomiphene citrate stimulates your body's own testosterone production. Peptide therapies, still emerging but may support hormonal axis regulation. Important, TRT isn't for everyone. It requires close monitoring to avoid side effects like high red blood cell count, prostate issues, or estrogen spikes. Final thoughts. 1030 in. Menopause and andropause are not just natural stages of aging. They are medical events with biological consequences, but they are also manageable. You don't have to suffer in silence. You don't have to guess what's wrong with your body, and you don't have to live with low energy, low mood, or low vitality. Talk to your doctor. Get tested. Take action, because your second half of life deserves the same passion, clarity, and power as your first. If this video helped you, please subscribe for more research-backed health content, share it with someone going through these changes, and let us know in the comments. What did no one tell you about menopause or andropause?